Hi, I'm Dr. Jasmine Shahina, Associate Professor from the Department of Microbiology, here to give a talk on dengue. Dengue viruses are transmitted to people through the bite of mosquitoes, Aedes species like Aedes aegypti or Aedes albopictus. These mosquitoes not only transmit the dengue virus, but they also transmit Zika as well as chikungunya virus. About 4 billion people are actually living in area with a risk of acquiring dengue. Every year, 400 million people get infected with dengue, or approximately 100 million people get sick from this infection, and 40,000 people die from severe dengue infections. There are 4 types of dengue viruses: dengue virus 1, 2, 3, and 4. And therefore, a person can get infected with the dengue virus as many as 4 times in his or her lifetime. Mode of transmission of dengue is primarily through the bite of infective female Aedes mosquito. The mosquito would become infected once it draws blood from a patient who is having dengue infection. Subsequently, when it bites a healthy individual, it will transmit the virus, and the virus will replicate inside the body of the healthy person, and thereby he will acquire dengue infection. The other modes of transmission includes blood transfusion, organ transplantation, and it can also be transmitted from an infected woman to her fetus during the delivery. Also, through needle stick injury or laboratory accidents which happen during the processing and handling of the sample. Mosquito-borne transmission. First, the infectivity period. Symptomatic as well as asymptomatic patients who are viremic, meaning who are showing the presence of virus in the blood, are able to transmit this dengue viruses to the mosquitoes when the mosquito bites them, which happens approximately during 0 to 7 day period. This viremic period, we call it as period of infectivity. Following the sucking of blood from an infected individual, inside the body of the mosquito, the dengue virus will replicate in about 8 to 12 days. This particular period, we call it as extrinsic incubation period. Now, once such infected mosquito bites another healthy individual, the virus is transmitted inside the body of the healthy individuals, where the dengue virus is going to replicate. Following 3 to 14 days after that, the person will start showing signs and symptoms, and he will fall sick with dengue infection. Clinical course of disease. Dengue is a systemic disease where it can affect almost every organ or almost all the organs in our body. So patients who start showing signs and symptoms, they will have fever accompanied with headache and muscle ache on the second day. Following 4th day, they will show consistent or persistent vomiting along with other signs and symptoms. Now, the clinical course of the dengue infection, actually there are 3 phases, like febrile phase, there is a critical phase, and there is a recovery phase. Now, it is important that we understand the clinical course of the disease, because we have to recognize the warning signs and symptoms and the medical complications which are caused by the dengue virus, so that we are able to provide the correct treatment and thereby prevent morbidity and death of an individual. The first phase of the dengue, which is the febrile phase, some of the characteristic features includes, it typically starts, or the duration is from 0 to 7 days. Biphasic fever is possible. Sometimes the fever is very high, sometimes the fever is very low. It is important that one should monitor for defervescence, which means to say fall in the temperature or the dip in the temperature where the patients experience sweating. It is important that we look for that, plus other warning signs and symptoms, because it will help us in understand when the patient is going to progress into the next stage or the next phase, which is called as the critical phase. Defervescence occurs between usually 3 to 8 days of the illness. Now, other than the high temperature, which is experienced by the patients during the febrile phase, other signs and symptoms include severe headache, retroorbital pain, there is muscle pain, there is arthalgia, macular or macular-papular rash, hemorrhagic manifestation like petechiae. Petechiae is nothing but brown or red color spots which are observed because of the bleeding under the surface of the skin. There is ecchymosis, purpura, and epitaxis, bleeding from the gums, hematuria, or a positive tourniquet test. Now, this particular test is done to detect dengue infection. There is facial flushing as well as erythema, which is observed in the patients, and anorexia. It is not compulsory that the patient must show all the above mentioned signs and symptoms. Sometimes the patients can have just fever alone. So some of the laboratory findings that can actually help that the person is in the febrile phase of infection includes detecting for the presence of the WBCs as well as the platelets. So there would be like leukopenia. Leukopenia is nothing but decrease in the number of WBC cells. Mild to moderate thrombocytopenia, which is less number of platelets, decrease in the number of platelets, elevated levels of aspirate aminotransferase levels, and elevated alanine aminotransferase level. And hyponatremia. Hyponatremia is nothing but decreased levels of sodiums. The next phase is the critical phase. Critical phase typically begins around the time of effervescence. That is when there is a dip in the temperature. But it can also start as early as the third day when the patient is still suffering with fever. Now, this is the period when those who develop severe disease are actually going to fall critically ill. But sometimes most of the patients usually improve during this phase and do not develop severe disease. So some of the warning signs of the critical phase includes clinical fluid accumulation such as ascites, accumulation of fluid in the abdomen, pleural effusion is observed. There is liver enlargement that is greater than 2 centimeter, severe abdominal pain, persistent vomiting, mucosal bleeding, lethargy, or restlessness. So this particular phase, the critical phase, can be identified by detecting the platelets. That is, there is rapid decline in the platelet counts. The patients can also develop leukopenia up to 24 hours before there is a drop in the platelet count. Also, we have to look for other signs and symptoms for severe disease. The last phase of the dengue is the recovery phase, where the patient is going to recover from the dengue infection. Now, the recovery of this particular phase is going to depend upon the severity of the infection and the treatments which are prescribed during the febrile as well as in the critical phases. So the recovery phase can actually be identified by looking into the patient's improvement. There will be gradual reabsorption of extravasated fluid like plasma leakage, increase diuresis, which means to say patient will have the urge to pass urine several times. Hemodynamic status stabilizes. The patients can temporarily become bradycardic. Bradycardic is nothing but lower slow heartbeat when compared to the normal one, but their hemodynamic status will be normal. The clinical manifestations during this particular recovery phase includes a secondary rash is usually observed, which can be macular or erythematous. And this is highly pruritic, meaning there is intense itching followed by scaling of skin, which is desquamate. Laboratory findings like hematocrit stabilizes, or it is slightly lower because there is dilution, which is happened because of the reabsorption of plasma. That we call that as hemodilution. The white blood cells and the platelet counts, which were actually very low during the febrile phase and the critical phase, will now start increasing, which actually is a very good sign that the person or the patient is actually recovering from dengue infection. Talking about treatment for dengue, there are no specific treatments available for dengue. But there are a lot of medicines which can be prescribed in order to suppress the severe signs and symptoms that a patient is actually displaying. But one of the most important advice or the recommendation from the doctor is to drink plenty of water. Now, this is to be done in order to avoid dehydration, which is observed because of extensive or persistent vomiting and high fever. A vaccine called Dengue actually can be given, which can prevent dengue virus, and these are available in few countries. Now, this is given to the people of the age group 9 to 45 years of age. They can take this vaccine, and this vaccine is actually effective against all the 4 subtypes that we have just come across. This vaccine is actually given in a sequence of 3 dose shots. So finally, to prevent dengue, prevent mosquito from breeding. So that we can do by eliminating all the breeding sites, like wherever the water is stagnating or wherever there is waterlogging in and around the environment, make sure that there is no waterlogging. We close all that. Remove all sources of stagnated water accumulation, whether they are from pots or open containers or discarded tires or jars. Keep storage tank always covered. Wear full sleeved clothes in order to avoid exposure to the mosquito. Use mosquito nets while sleeping, even during the daytime. Use mosquito repellents during the day as well as during the night time. Now, it is better that we always take care, because we all know prevention is better than cure. And in case of fever and development of any other signs and symptoms, it is better that we visit or consult a doctor. So to summarize, dengue. Now, dengue fever is usually caused by the virus, dengue virus, which belongs to the flavivirus genus, which is transmitted by the bite of Aedes aegypti, who are the carriers. A lot of people die because of this particular infection. About 3.9 billion people get affected globally, and over 20,000 deaths are observed annually. So what happens? How do we acquire the dengue infection? Obviously through the mosquito which carries the dengue virus. And that virus becomes infected from the person who actually has this virus. So this particular virus, when it bites a healthy individual, it delivers the virus inside the body of the host, that is the healthy individual, where it's going to replicate and it's going to start showing, this infected individual is going to start showing signs and symptoms after about 4 to 13 days. So these are the signs and symptoms that we just came across following all the 3 phases, which include high fever, severe headaches, pain behind the eyes, severe joint pain, severe muscle pain, nausea, vomiting, skin rashes. And let's not forget the count of WBC as well as the platelet counts, which are going to be really, really low. So thank you so much. This is all about dengue. Thank you for the opportunity given.